Thank you so much for tuning in. We are going to talk about how to become an infectious disease pharmacist and what are the roles and responsibilities of an infectious disease pharmacist. My name is Dr. Kayihura Manigawa. You can call me Dr. K. I'm an associate professor at the University of Tennessee College of Pharmacy. I'm also a board certified infectious disease pharmacist. If you're exploring different careers, you're trying to figure out, is infectious disease pharmacy a career for me? Or what does an infectious disease pharmacist do? Is that something that I may be interested in? This is for you. This is for you. Hang around if you like to know more. If would you like to be an infectious disease pharmacist? How can you get there? And also, what will you be doing as an infectious disease pharmacist? I'll be able to answer all those by the end of this session. But one of the things that I would like to start with before we jump in is like a virtue that I practice that I always like to share with my students, the gratitude practice. As a professor, I always try to be centered and teach from a place of caring. So when I'm grateful, I think it's something that center me and I can refocus. So in this moment, I'm grateful that you're watching. I'm grateful that you tuned in. And another thing that I like to share, I always want to share a little bit about my life. And this is me and my family. I'm grateful to have a 9-month-old baby, Noah. This is Mama Noah. This is our first snow together in Memphis, Tennessee. So this is incredible. I'm very deeply grateful about that. I always encourage my students to pause and find something to be grateful for. And a lot of students will find like, oh wow, I'm grateful about family. I'm grateful about a dog. You can be grateful that you're alive, breathing, and well. Enough of pharmacy, enough of pharmacy. Let me get going and tell you about what are the training do you need to become an infectious disease pharmacist. You need a pharmacy doctorate. And in my case, I completed my doctorate in pharmacy at the University of Tennessee Health Science Center. You need, for the most part, a general pharmacy residency. Some people, after a general pharmacy residency, can specialize in infectious disease. That's what I did in my case. I did a general residency, PGY1, at the University of Florida, Shands Hospital. And then I did a PGY2, a postgraduate here to focusing on infectious disease. So then, once I completed my PGY2 in infectious disease, I had the credential to practice as an infectious disease pharmacist. Another route that some people can take is maybe you practice a little bit more, so you can do just a doctorate or a PGY1, and then go practice and you get enough experience treating patients with infectious disease, then you can start practicing as an infectious disease. And many times you need to take a certificate program. So we have a professional organization that will train pharmacists on, for example, antimicrobial stewardship. So if you don't do a specialty in infectious disease, you can still become an infectious disease pharmacist with enough experience. But the infectious disease residents will give you a lot of experience at once that by the time you're ready to start practicing. So once I finished my infectious disease residency, I went and became an infectious disease pharmacist. And my first job, I was responsible to establish antimicrobial stewardship at the hospital. So antimicrobial stewardship is one of your number one priority and role as an infectious disease pharmacist because we are living now in an era where we see patients and we can treat them. We have antimicrobial resistance. And as an infectious disease pharmacist, you are responsible, you are driving initiative to safeguard the antimicrobial because without antibiotics, we won't be able to treat our patients. Here you can see, starting in 1942, where we had our first patient that received antimicrobial penicillin. This is Miss Ann Miller, almost died in her 30s. But once she received an experimental drug called penicillin, she recovered and lived to her 90s. In this time, penicillin was considered a miracle drug because before penicillin, people with infection were dying. Now we're living at a time where we have antimicrobial resistance, as we have people who have an infection and we cannot treat it. This is considered an urgent global public health threat. In 2019 alone, 5 million deaths were associated with antimicrobial resistance. Infectious disease pharmacists leading stewardship program can reduce resistance because we're using antibiotics better. Overall, that leads to improved patient care and patient outcomes. You get to learn a lot about antimicrobial stewardship in pharmacy program. If you do residency training, you get to solidify your knowledge on how to do antimicrobial stewardship. But the basic is with antimicrobial stewardship, are we giving antibiotics to people who have an infection or antimicrobial to people who have infection? Are we using the right drug, the right dose? Are we monitoring patient effectively? Do we have patient on the right duration? Or are we treating longer? So as an infectious disease pharmacist, because you are equipped with all that knowledge, you are able to make sure that we are using antimicrobial effectively and wisely so we can prevent resistance. Another part of your role is providing direct patient care. On a given basis, you're reviewing patient. You could be reviewing patient who may be on specific class of antimicrobial. Maybe you're looking at a restricted list of antimicrobial. Each hospital may have a restricted policy where some antimicrobial are restricted for people with a specific infection. You may be reviewing those on a given basis. You could be reviewing people who are on antibiotics without a positive culture, or people who have a positive culture without on the right antimicrobials. Every day you are taking care of the patient, making sure that they're on the right antimicrobial. So you are making sure that we're using the right drug that treat effectively the pathogen, the bug that the patient have, but also taking into consideration the patient. We don't want to expose them to too much antimicrobial. We don't want to give them an antibiotics that will interact with the other medication and cause them to have a bad outcome. As an infectious disease pharmacist, you are intervening on a daily basis and working with the team through multidisciplinary rounds where you can provide your recommendation so patients are on the right antibiotics. Some of those recommendations may be to add on an antibiotics. Some of those recommendations may be to de-escalate or maybe discontinue antibiotics, maybe shorten patient. We treated enough 5 days. As an infectious disease, you are an expert in antimicrobial therapy. Everybody look at you during patient care to provide guidance on the right antimicrobial dosage duration. So you play a very critical role in caring for patients with infectious disease. And also you work very closely with the infection prevention and control team because this is the team that is responsible that there is no outbreak of resistance in the hospital, or if there is an outbreak to be contained. So this team, the infectious disease pharmacist, is a critical part of this team, making sure that patients have proper isolation, working on a policy maybe to MRSA, the colonization of MRSA, reducing the MRSA, which is the methicillin-resistant Staph aureus infection in the hospital. You can work with the infection control team, establish protocols that will reduce infection in your hospital. Another role as an infectious disease pharmacist is education. This is what I do mostly. You are teaching students, future pharmacists. You are teaching other healthcare providers. You are teaching everyone. You want to make sure everybody in the healthcare setting, they're equipped with the knowledge to do antimicrobial stewardship. The other part is research, because anytime you implement a new initiative, you need to assess to see, does this initiative make a difference? You need to research and also contribute to the literature, how we should be treating patients better and how to optimize our antimicrobial utilization. Another area that is growing is therapeutic drug monitoring. This is something that infectious disease pharmacists do more now. Traditionally, we've been monitoring medications such as vancomycin to make sure that we have enough concentration to treat the infection, but also we don't have too much to cause things such as kidney injury. But now we realize that not one size shoes fit everybody. We need even other antibiotics. We need to make sure that we're monitoring them. Beta-lactams such as cefepime carbapenem, meropenem. Infectious disease pharmacists are helping provider be able to interpret those levels and say, this concentration, this is what it means. Because you are equipped with that knowledge of pharmacokinetics to be able to look at the concentration and interpret that and help the patient. And also contribute to making sure that we're individualizing therapy because not everybody should be receiving just one dose for different type of infection. The other part that you're involved with is developing policy and procedure to make sure that everyone is we're standardizing practice so patient can receive the same care that they receive in the morning is the same that they receive in the evening, same in the weekend because you have the policy and procedure on how you're doing things. If you have a policy on how to reduce resistance in patients with urinary tract infection, that policy is being implemented. Even when an infectious disease pharmacist is not there, everyone is doing the right thing. As an infectious disease pharmacist, you empower people, you empower the team through making sure there are policy and procedure that everyone can reference even in your absence. So that's all for the infectious disease pharmacist. I think if you have any other question, please email me, reach out, drop a comment, let me know what question you have. If you have a question about a medication, if you have anything, I'm available. I'm here for you. This is my passion. I love sharing what I know. I hope this was useful. If you watched to this point, that tells me that you really care and you're very interested. I'm very grateful for you. So thank you so much. And again, let me know if there's any way I can help or if there's any way we can work together. I appreciate it. Have a wonderful day.